All right, looks like this is probably all the people that we'll have. So thank you for coming. Let's see, I got the closed caption on just in case people need it. So I'm going to talk today about a series of projects that our group is just beginning, primarily in collaboration with the Rutgers Office of the Chief State Medical Examiner. Before I jump into it, I want to say a bit about who we are because I think some of our larger mission is really relevant to a lot of the GVRC research. So I represent a group of people. We're all faculty at Rutgers. We have our own individual labs, and together we come together to form something called Rutgers Spark, which is our suicide prevention and research collaboratory. Collaboratory is a center without a physical center, which is what we decided to call ourselves because over the past 2 years, we've been working together to create a group of researchers across Rutgers that are focused on suicide research. Amazingly, there are a lot of us here that do suicide research. There's about 20 people across Rutgers whose program of research either completely or to some part involves studying suicide. Our group does a variety of activities. We have monthly seminars with outside speakers. We have weekly graduate student mentorship meetings, and we have several grants beyond the project I'm going to talk about here that are under review and in preparation. So our team focuses on a wide range of things in the research that we do beyond what I'm going to talk about here for a couple of minutes. Focuses on areas like clinical trials. We have a lot of expertise in our team in dialectical behavior therapy. One of our main kind of people along with me is Shireen Rizvi, who's an expert in dialectical behavior therapy. We do work on advanced designs like smart designs that help allocate people who need an intervention to the appropriate level of an intervention. We do a lot of work with technology and research and practice. So my primary area of research is using things like smartphones and wearables to predict and prevent suicide. And then we additionally have expertise through our other member, Paul Duberstein, on psychological autopsy. And that's going to be one of the main focuses of what I'm covering today. So that's our first part, right? Rutgers Spark, that's the researchers. Then we also have a strong collaboration that we've been building over the past few months, and we're going to continue to strengthen with the Office of the Chief State Medical Examiner. So the Chief State Medical Examiner is Dr. Andrew Falzon. He has an office that oversees the county medical examiner offices, which is how things are structured here in New Jersey. And there are state-run medical examiner offices as well. So basically, there are several offices that have direct or indirect involvement on all suicide deaths. So if someone dies by suicide in New Jersey, Dr. Falzon's office is involved to some degree or another. The reason why suicide, especially suicide death, is something that is notable in New Jersey, this is something that most people probably know, but New Jersey historically has had one of the lowest suicide rates. And as a result of that, we want to learn more. So we're doing two projects that I'll briefly talk about here and then see if people have questions. The first project I'll talk about is an analysis of case reports from suicide and firearm deaths. The second project is implementing and advancing the science behind something called a psychological autopsy. This is a not widely used method that used to be used quite a bit that is of quite immense value if applied to current work. So let's talk a bit about the project that we're about to start, looking at analysis of existing data. And so every time someone dies in New Jersey, there is a report, true of any other state in the country, and that report includes information, including a narrative of the death. This is important information because that information tells us as much as is really available about the circumstances and the context surrounding someone who died, either by firearm, suicide, or other methods. What we're interested in doing is trying to see if we can capture information from these reports. Sometimes they're a sentence, sometimes they're a few paragraphs that help tell us something about how to characterize suicide deaths in New Jersey. So we can see our suicide deaths by one method, for example, firearms, versus another more likely after being with others or after some other justice system involvement or mental health emergency involvement, so other gun violence or domestic violence. So we're going to code the case synopses of several thousand deaths over several years to try and get a better sense of the context that we can derive from these notes. The second project, this is sort of the I guess, bigger endeavor that will hopefully last several years as a result of this pilot funding, is a psychological autopsy process. So a psychological autopsy is a gold standard method of getting an in-depth understanding of the psychosocial factors associated with death. This is important because it gets information that is typically beyond just this case synopsis, right? So the case synopsis I just described was really just a few lines at most. Clearly, to understand the circumstances around someone's death, especially if it were a death by suicide, especially suicide by firearm, requires a much more in-depth understanding than just a few lines. So psychological autopsies involve training to teach people how to do structured interviews with family members and friends to better get the context surrounding a loved one's death. Our team, the specific project, will give training to people on our teams to do psychological autopsies. This is important because the training is quite in-depth. It takes about a day for the full training, and then it requires doing case examples, having them reviewed, and eventually getting certified. What we'll be doing is conducting autopsies, and the goal of these psychological autopsies will be not just to do the psychological autopsies to gain information and insight, but rather to begin thinking as an infrastructure type of manner to deploy psychological autopsies statewide. This is not something that's really done, but it's important because this way we can collect the information around someone's psychosocial context that we wouldn't necessarily get otherwise. One issue, though, with psychological autopsies is classically they don't factor on or focus on factors like an individual's digital footprint. Digital footprint refers to things like their social media usage, their phone usage, basically all of the things that occur digitally that 5, 10, 15, 20 years ago didn't necessarily exist. This is really important because digital tools that include information like this is crucial to better understand suicide, determining cause of death, and to better understand the circumstances around someone's death. Psychological autopsies have existed well before this type of technology, and so as a result, typically people don't consider that when doing an autopsy. This is especially important because this kind of information can change quickly. Families might set things to private, or the information might not be accessible after a certain amount of time. And so figuring out how to compassionately and appropriately learn what we can from someone's digital footprint is really useful for the insight into figuring out the circumstances around why someone would die by suicide. So a concrete example I'll kind of wrap up my brief presentation on here is that a suicide note is informative in telling if a death was a suicide, right? And so historically, it's been difficult to determine in some cases if a death was a suicide or an accident without other context. A suicide note is typically an easy way to see if, unfortunately, someone who's died has died by suicide. People don't necessarily leave suicide notes like they did previously. They don't write a handwritten note because most people don't do a ton of handwritten notes anymore. So some of these things might be found in an electronic way. For example, something on someone's computer or on the Notes app on their phone. If we're not able to extract that information and learn, then it's really difficult to accurately determine a cause of death. So our goal is in deploying psychological autopsies to do our best to modernize the way psychological autopsies are done, both by figuring out how to better capture digital data, but also how to do these in a way that doesn't necessarily involve having to go to someone's house, knocking on the door, and getting information from them while they're grieving, but rather doing it in a remote, decentralized way that makes things a little bit easier on the people that are giving the information. Okay, so that is my overview. I'm happy to answer questions if people have them. If not, I'm also happy to let you go early to your next session.